the open debate, and that's Claire Hawkey.
Thank you, Presiding Officer, and I hope the Chamber will forgive me for approaching this debate from a health perspective, and as such I duly refer members to my entry in the Register of Interests as a registered mental health nurse and to my honorary contract with Greater Glasgow and Clyde NHS. Apart from the most hardened of Brexiteers, surely no one can doubt or deny the potential that Brexit will have anything but a profoundly adverse effect on our health sector. Indeed, in an article published in The Lancet last month, the authors concluded that no matter whether Brexit is soft, hard or failed, then it will still pose a substantial threat to our NHS. Our health sector and of course all other sectors must be protected during the Brexit process, and that's why it is vital that the Scottish Government's voice is heard and has meaningful influence alongside the other devolved nations in the negotiations. Although matters pertaining to health are largely devolved to the Scottish Parliament, there are still many important areas which are reserved to Westminster, be that embryology, surrogacy and genetics, or xenotransplantation, or the working hours of healthcare staff through the provisions of the Working Time Directive. There's no escaping the fact that our health service can be directly affected through any negotiations. It is incredibly worrying that the government leading this process is one which appears utterly clueless, is rife with infighting and is in complete denial about the possible effects of Brexit, particularly on our NHS. Through an answer to a written question tabled to the Tory government by MP Justin Madders, the UK government confirmed that they were not able to disclose the number of officials in the department for exiting the European Union who were health experts. If they don't know such basic information as who in their workforce are experts in health, then how can we trust them to prioritise such a sector during these negotiations? The Tory government's biggest mistake during this process so far is clearly that it has not guaranteed the rights of EU citizens living in the UK and vice versa. It's not only the Scottish Government who are demanding Tories safeguard the rights of EU nationals, their partners and dependents living in the UK, but leading charities like Cancer Research UK. It's absolutely appalling that rather than doing so, the Westminster Government are pushing ahead with plans to force EU nationals to apply and to pay for settled status. There are up to 20,000 EU nationals who work in Scotland's hospitals, in the social care sector, in schools and our other public agencies. And the contribution they make to Scotland is overwhelmingly positive. These EU nationals have made Scotland and the UK their home, so the Prime Minister should do the honourable thing and abandon this proposal. In her speech on Monday, during the European Council statement, the Prime Minister stated that the fee for this will cost no more than a UK passport. Well, currently an adult's passport costs £72.50, whilst a child's passport costs £46. So for a family of 4 on the UK government's living wage, they'll need to work 32 hours, a full week's wages, to pay to apply for settled status. In stark contrast, this Scottish Government will ensure that EU citizens who work in the Scottish public sector will have their fees paid for them. The SNP Scottish Government treats EU nationals with compassion and care, and the Westminster Tories treat them as bargaining chips. As widely reported this week, almost £30 billion will be wiped off the Scottish economy in 5 years if the UK Government failed to reach a deal with the European Union, as per the research undertaken by the London School of Economics. Through these figures, my Rutherglen constituency's local authority area, South Lanarkshire, would be worse off by a staggering £1.3 billion. As such, no deal is not an option. Further research carried out by the Brexit Healthcare Alliance, an organisation comprising of patient groups, charities, NHS bodies, medical research and industry groups, found that a no-deal Brexit that ends healthcare arrangements between the UK and the EU could end up costing national health services across the UK £500 million a year. It also found that travel insurance for trips to Europe may become unaffordable for people with existing health problems, while the NHS could face additional pressures if British citizens living abroad were no longer able to access reciprocal health care. The Nuffield Trust estimates that an extra 190,000 people could require hospital beds in the UK if such healthcare arrangements are scrapped, creating incredible demands for doctors, nurses, healthcare professionals and support staff. Presiding Officer, another major issue which requires attention is our future relationship with the European Medicines Agency post-Brexit. Notwithstanding the fact that it is the largest EU organisation based in the UK and that it employs 900 staff, but thanks to its existence, UK residents have access to new treatments and drugs up to 6 months earlier than some other countries like Canada and Australia. Through the EMA, pharmaceutical companies only need to submit a single application, which, when granted, allows that particular treatment to be licensed throughout the EU and the EEA. Having no deal and ending our relationship with institutes like the EMA is not an option we can consider if our population is to have timely and safe access to new drugs and new treatments. Presiding Officer, we need a deal to ensure that EU nationals can continue to live in Scotland and to work in our NHS. We need a deal to ensure that reciprocal healthcare arrangements are in place, and we need a deal to ensure that our economy is not irreparably damaged.